Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing blocked tear ducts. Okay, but first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So what is a blocked tear duct? So a lot of people have a misconception by just hearing that, a blocked tear duct. Okay, they'd have really dry eyes, but this is actually just the opposite, okay? Your eyes can't drain normally, leaving you with watery, irritated eyes, okay? So the condition is caused by a partial or complete obstruction of the tear drainage system, okay? This is actually very common with newborns, but in adults, it could be due to an injury, infection, or a tumor. Now, before you go to thinking the worst, it is rarely caused by a tumor. Okay, there is normally another reason for it, and it's normally always correctable. So what are the symptoms that you might experience if you have a blocked tear duct? So excessive tearing, okay? So you'll have an excess of fluid in your eyes, making you tear, okay? You may have redness of the white part of your eye. So your eye won't be white, it will be reddening, okay? Recurrent eye infections or inflammation, so pink eye. Painful swelling near the corners of your eyes, right in here, okay, where the drains are. Crusting of the eyelids, mucus or pus discharge, okay, and even blurred vision. When we get that excess amount of fluid in our eyes, it can cause that blurred vision. So what are the causes of a blocked tear duct? So they really can happen at any age. It does happen frequently in newborn babies because their drainage system may not be fully developed, or there may be just slight abnormalities to it, okay? Normally, we do the watch and wait method with newborns, and it normally just corrects itself, okay? Age-related changes, so tiny openings that drains tears, they may get narrower and cause blockages, okay, as we age. Inflammation or infection, injury, trauma to the face, to the eyes area, it can cause scarring within the ducts, okay? It can cause blockages, even small particles of dirt getting in there, loose cells. It can all get into the drainage system and clog it, okay? Once again, in rare cases, tumors can cause narrowing or blockage of that drainage system. Eye drops, once again, rarely over, it's a very rare occurrence, but using eye drops for a prolonged period of time, and cancer treatments, okay, it can have the effect to the drainage system. So how does the tear draining system work? Okay, so the lacrimal glands produce most of our tears. Okay, these glands are located on the inside upper lid above each eye. Normally, tears flow from the lacrimal glands over the surface of the eyes. Tears drain into openings on the inside corners of your upper and lower eyelids. These openings lead to small canals that move tears into sacs on the inside of our nose. From there, tears travel down to a duct and drain into your nose. Once in the nose, the tears are reabsorbed. A blockage can occur at any point, okay? So from the openings in the corner of our eyes all the way to our nose, okay? So we do have to find where the blockage is, where it's happening, to be able to correct it. So what are the risk factors that increase your risk of having a blocked tear duct? So age, chronic eye inflammation, having previous eye surgeries, glaucoma, previous cancer treatments, okay? They all will increase your risk of developing a blocked tear duct, but honestly, this can really happen to anyone. So complications, okay? Because the tears aren't draining properly, the drainage system, it does become stagnant, okay? So then if it's not flowing properly, this promotes a breeding ground for bacteria, viruses, fungi, which can lead to reoccurrent eye infections and inflammation, okay? And this can happen in any part of the draining system, including the membrane over top of your eyes, okay? So it can become infected or inflamed, or the whole drainage system can become infected or inflamed. Okay, so prevention. So reduce your risk of developing a blocked tear duct. What can we do? So we're going to wash our hands thoroughly and often, and we're not going to touch our eyes. Okay, do not rub your eyes. Replace your eyeliner, mascara regularly. Okay, never share these products. If you wear contacts, make sure that you're cleaning them according to recommendations provided by the manufacturer. So diagnosing this condition, so you want to talk to your doctor about your signs and symptoms that you are experiencing, and they will probably examine your eyes and inside your nose. They'll probably send you for a referral to the eye doctor because they specialize in these things. Some different tests that they can do. So there is one where it's the tear drainage test. They put a drop in each eye and see how long it drains. If after 5 minutes, most of the dye is still on the eye, we know it's not draining properly. Irrigating and probing, so they can irrigate the drainage system. They can also put a very thin probe through the system, and a lot of times this will actually clear out anything that's stuck in there. And then they have eye imaging tests. So it's CT or MRI. They can do either both to try to find the blockage. So treatments. So other treatments that we can use is medications to fight any infection. If you've had a facial injury that has caused a blocked tear duct, your doctor may suggest that we do the wait and see method to see if it corrects itself. Okay. Once again, they have where they can flush it or put a probe through the line. They can put in stents, and they can also go through with a little catheter and inflate the balloon a few times to clear it out, make it a little wider. They do this for people with really narrow ducts. And they only really do this after trying the other methods. So this is like, okay, the other methods are not working. Let's try this method. So when do we see our doctor? So if you have constant tearing, especially after a few days, or repeated infections or inflammation in the eyes, you want to talk to your doctor, okay? Also, if it is a tumor, early detection is key, as we have more treatment options, okay? So that's when we would go to the doctor after a few days of constant tearing. So that's all I have for this video, guys. I hope it did give you a better understanding of the signs and symptoms of a blocked tear duct and what we can do and what you should do when you experience these issues. But once again, that's all I have for this video, guys. I hope to catch you in my next one. I hope you have a wonderful day, and I'll see you next time. Bye.